This chapter deals with the question of how do we use the ultrasound machine and how do we acquire nice images in 2D. Now, the ultrasound machines often look very complex at the first glance, but in reality, they are not really that complex. And you will, I'm sure, learn how to use the ultrasound machine quite quickly, especially since the ultrasound vendors often provide features which can really make it easy for you, such as buttons which you press, which optimize the entire image. But still, you need to know at least some basics. The keyboard of your echo machine is like the cockpit of an airplane. And just like every airplane has a different cockpit, every machine has a different keyboard. But the general features of the keyboard are the same across the different ultrasound platforms. And even though some machines have 1,000 functions, some hidden behind touch screens and buttons and who knows what, in reality you will only be using a few. But one important advice, really get to know your machine. Talk to your application specialist and know which buttons and functions you have, because if you know how to use them, you will speed up the exam and you will also improve the quality of the exam. Okay, but let's now talk about the main settings that you should consider when you perform echocardiography. The gain, the time gain compensation, the depth, the frequency, the sector width, the focus, and finally post-processing. Let's start with the gain. Probably the most important button in echocardiography on the machines is the gain button. It's similar to the volume button on your stereo. And it's this button here. And you can see what happens. If I turn this button, I will increase or decrease the intensity of the image. Now, how will you want to set it? Basically, somewhere in a medial position, because if you have it too dark, obviously you won't see anything. You will just erase some of the important speckles, while if you increase the gain too much, you will have blurring and you will have no potential to discriminate different grayscales here, especially in the high range. So you should always try to see that you have a medial gain setting so that the brightest part is the endocardium. So this is usually the brightest part of the image. Remember, we talked about attenuation and the problem that the ultrasound beam loses energy as it travels into the body. Now, this would result in an image which gets darker and darker the further down we get. Well, there's a solution to that problem. We can use what we call time gain compensation.
I'd like to give you some tips about the TGT control. Usually, when I start the examination, I start with the TGT here and put them in the middle. So I have the possibility to move in some directions, give a little bit less gain, and in some give a little bit more gain. So what happens? You see here you have the small sliders, and they are according to the depth, giving a little bit more or less gain. I can show you just by taking one of these sliders and put it to the maximum. You see you get a, maybe move the others a little bit down, you see you have a bright spot just in the middle. So what is it good for? You may have an image where you have the impression that you need just a little bit more gain, in example in the depth, for example here for the posterior wall. Then you just take this area and give a little bit more gain instead of over gaining the rest of the image. So you can really focus on the area you need just a little bit more or less gain and adjust it.
In modern imaging transducers, you can change the imaging frequency. And this has a profound impact on the quality of the image. In the following demo, you will see what happens to the image when we change the imaging frequency. In modern transducers, you can actually change the transducer frequency, and you can also change the mode of imaging from fundamental to harmonic imaging. I will show you now what happens if I change or if I modify the image frequency. Let us now start with this setting here. What we have is we have a transducer frequency of 2 megahertz send frequency and receive 4.3. So we have harmonic imaging turned on, and we can see how good the image quality actually is.
Now if I switch the transducer frequency to 1.9, to 1.7, and to 1.6, and even further down to 1.5 to 3.1 receive, you can see how the quality of the image actually changes. So you have the possibility to adapting your frequency, for example, to the depth that you want to image. In him, he's a patient which is very good to image. We will try to use a frequency which is fairly high so that we get the best resolution possible. So here I would use 2.0 send frequency and 4.3 receive frequency.
Most echo machines allow you to change the width of the sector. What is that good for? Don't you want to see as much as possible? Aren't larger windows basically what you want to have in every house? Well, yes and no. If we have a wide sector, we don't have the same line density that we would if we have a smaller sector. So if we reduce the window, we can cram all the processing information and the number of ultrasound beams we have into a smaller region and thereby increase the 2D resolution. But there's also another advantage of a small beam width. It is not only the 2D resolution that improves, it's also the frame rate that improves. What is the lesson? Always try to use the smallest possible sector width you can.
The ultrasound machine is not much different than a camera. With ultrasound, you also have to focus the image.
When an ultrasound wave is generated from a crystal, it usually radiates in all directions. To focus this ultrasound beam, a special technology is used in transducers, where we have multiple crystals which are fired simultaneously or shortly after each other, and thereby a wavefront is created. And this wavefront can be steered and focused to a certain point. So in reality, an ultrasound beam looks something like this, where we have an area where the width of the beam is very narrow, and this is also the focus point. What is the result? Well, take a look at these two images here. Here on the left, we have a region where the focus is fairly far down in the far field. You can see that we have a very good delineation of the points down here, while here in this example, we have the focus point in the near field, and thereby the best resolution is right here.
We can also change the focus. The focus is displayed by usually some form of a marker here on the scale for the depth, and it symbolizes where the focus point is. So in this case, it would be somewhere in the top third of the image. You can change the focus point by switching this button all the way down to, for example, here. Not that anybody would want the focus point there, but you can do it. And then you can move it all the way up to the apex as well. Where would it be a good thing to change the focus point? For example, if you're looking for a thrombus here in the apex, then you have a better image resolution here, right where you want to see the thrombus. One other thing you can do is you can use dual focus. Some machines can do that, where you now have two different focus points which you can adjust and thereby try to focus at two regions at the same time. So this is how you would adjust the focus point.
A very important button is the so-called depth button. With the depth button, you can kind of determine how deeply you want to penetrate with your image into the body. You have a scale here on the side where you can read exactly what your depth setting is, and usually you also have a numerical value somewhere on your screen. Now, this is the same patient imaged with different depth settings. You can see that in this case we do not have the entire heart in the screen, while we do have the entire heart down here, but we also have a lot of information which you do not need. So in reality, you should use some kind of an intermediate setting, for example, a setting like this and maybe like this. But there are also other things that you have to consider if you want to image structures which are very far away from the transducer and the depth of the body. Imagine you go diving. Isn't it nicer to stay near the surface? There you have a much better visibility. And this is the same also with ultrasound. There is a limitation to penetration. If you want to go deeper, you usually have to use lower imaging frequencies. And this also means lower resolution, not only lateral but also axial resolution, and it also means that the frame rates drop. I already mentioned that the ultrasound machine is not much different than a camera.
In both, we have a focus, and in both, we also have the potential to enlarge the image. In ultrasound, we call that the zoom or res function.
So we are talking now a little bit about the zoom functions. It might be interesting, for example, for the valves to get a little bit bigger image and to zoom it out. So you have a nice rotational knob, which you just rotate it and adjust the image size you want to have. Don't make it too small, you should still see the whole valve in example. So you see here, if you use the normal zoom, frame rate will still be the same, because it's just a magnification of the 2D image. In case you want to have more higher resolution and also more frame rate, you can use the high resolution zoom just by pressing the one knob here. You see the image gets much more detailed and you get also more frame rate. You can see here now we have 130 frames per second.
Imagine you're on vacation and you take a photo which is very important to you. But unfortunately, the lighting situation is not very good. What do? Well, you take this photo to your computer and you play around with it with special software, with imaging processing software, and then you end up with a photo which looks much better than the original photo.
Basically, this is exactly what post-processing is. It's taking the information we have and trying to change it and manipulate it in such a way that it appears better for the eye. In echocardiography, the object is to enhance our ability to interpret structures and to make a diagnosis. Here's an example of what post-processing can do to the original image. You get all sorts of different variations of this image just by changing a lot of different things. For example, the grayscale, the contrast, the compression, and many other things. The truth is, however, that very rarely can you really get a much better image. My recommendation is just to find one setting which suits you and then just leave it there. Put it in your presets and you'll do fine in most instances.
So in conclusion, echocardiography and photography share a lot of similarities. You can make very good pictures actually with cameras which are not so expensive, and the same is also true for ultrasound machines. And you do not have to use very many buttons to make a good photo, and the same is also true for echocardiography. Again, the most important thing is of course the motive and the way you hold the camera, the way you hold the transducer.